Okay, this is part 3. We're talking about the brain, dementia, stroke, excitotoxins, things that cause a decline in cognitive function. And I want to briefly talk about this paper. It's written by a Dr. Kirsten Schuler, and it was about when you have a small, like periventricular, let's say corona radiata, centrum semiovale, deep white matter stroke in the brain. And these are often called chronic ischemic changes, small vessel, atherosclerotic ischemic disease. The relevance is you'll have a central core or dead brain tissue, core infarct, all right? But in the periphery, you'll have what is called a penumbra. Penumbra means twilight, like in Greek. And that is tissue that's, could go either way. It might progressively get worse and die. It might improve and become normal. But it's at risk, brain tissue at risk. The relevance is there's a breakdown in the blood-brain barrier in these areas. And so toxins in the blood from eating an unhealthy diet, bacterial endotoxins from leaky gut, toxins from processed food, they get access to those brain tissues in that spot, and they can finish off those vulnerable cells and cause a gradual expansion of these deep white matter strokes. And so that's bad. Whenever you get traumatic brain injury, you get leaky blood-brain barrier. Whenever you have leaky gut, you get leaky blood-brain barrier. Whenever you have a stroke, you get adjacent leaky blood-brain barrier. So there's a lot of leaky blood-brain barrier going on. You'll get it, when patients, often have diabetes and hypertension. It's going to lead to problems, breakdown of the blood-brain barrier in some locations. Okay, we're going to get into some more of the pictures now. And I'm going through some of these advanced topics because that's why you're here. If you want baby talk, go to one of the other channels. At my channel, we're going to, I'll do a lot of introductory stuff, but I got to get to the advanced stuff too. Sort of my audience is better informed, more educated, more interested in these things. Okay, here's the issue with iron. Now, it's normal to have some iron in our body, of course, okay? Iron is a transitional metal. It has a variable valence, like here's Fe2+, here's the Fe3+ version of it. And you normally should have iron always bound. Intracellular, it's bound to ferritin. When it's in the blood, it should be with transferrin. Transports it around like a little kayak, okay? Iron should never be free. As Eugene Weinberg had said, iron is like fire, okay? In your house, you want fire in the stove. You want fire in the fireplace, in the furnace, to keep you warm. You don't want fire anywhere else, so it'll burn stuff up, and that's what iron is like in the body. You want iron, attached to hemoglobin with its variable valence. It can hand off oxygen when need be to deliver it to the tissues. You want iron in the electron transport chain, iron-sulfur proteins that facilitate transferring electrons down the chain. But you don't want iron floating around free in the cytoplasm, in the mitochondria, or in the blood. Free iron causes trouble. Free iron will undergo what's called ferrous redox cycling to cycle back and forth between Fe2+, Fe3+, Fe2+, Fe3+. Fe means, that's the chemical symbol for ferrous, which means like rust in Latin. Okay, and it'll also undergo something called the Fenton reaction, which is pretty easy to remember because ferrous starts with the letter Fe and Fenton also starts with the letter Fe. And this will eventually lead to the production of hydroxyl radicals, which can go around damaging whatever tissue is nearby. So men in the Western world tend to be iron overloaded by their late 20s. Women, by around 60 once they're postmenopausal. And because they eat a lot of meat, and they also tend to eat a lot of processed food fortified with iron. They add iron to it. It's bad. It's really bad. They just grind up pieces of iron. It's disgusting. Okay, so people tend to be iron overload. This will also predispose to amyloid clotting within the blood, changing the shape of ferritin, of the blood clotting protein, fibrinogen, from alpha helix, secondary protein structure, to beta pleated sheet. So it'll form big, large molecules that precipitate in the blood, precipitate in aqueous solution. To precipitate is to clot. So what I'm basically saying is just like LPS and LTA and infections, viral infections, bacterial infections, this will cause amyloid clotting and can lead to dementia, atrial fibrillation, atherosclerosis, etc. Because atherosclerosis is a blood clot. Typical amyloid clots, 2 to 200 microns. And again, the people who did the most work on this were Douglas Kell, PhD from England, and Etheresia Pretorius, PhD lady from South Africa. Okay, so now here's a neuron, basic anatomy of a neuron, a brain cell. You've got the cell body, which is where the nucleus is, over here. Here's the nucleus. You have the axon hillock, the beginning of the connector part of the neuron. and that extends distally out to the synapse. At the site of the synapse, these little NTs stand for neurotransmitter. They're stored in vesicles. When the neuron is activated, these neurotransmitter vesicles will travel to the synaptic cleft. They'll merge with the plasma membrane of this presynaptic neuron. This is the synapse right here, so this is pre, as in before, presynaptic neuron. The neurotransmitter will diffuse across the cleft, bind to a receptor on the postsynaptic neuron, and have an effect on it. Okay? That's typical neuronal transmission. The action potential typically begins at the axon hillock, and it travels down the axon to activate the axon terminal. Dendrites are where incoming information, the sensory component of the neuron, gets its inputs from. Oh, by the way, in popular press, you always hear about all the glamorous neurotransmitters, about dopamine, about epinephrine, stuff like that. But in the real world, 90% of cortical neurotransmitters are glutamate, and it's the on switch. It turns things on, activates things. You need to know that. About 5% are GABA, and it's the off switch. It shuts things off. And all the other ones are really uncommon. They're in the ballpark of 1%. And that's things like acetylcholine, norepinephrine, serotonin, dopamine. All the glamorous neurotransmitters are actually uncommon. Okay. Okay, now here is a neuron with more anatomic detail. It's the calcium channel, the sodium channels. Na stands for natrium, which is like the Latin for sodium and for salt. So the natrium, sodium, is what carries the action potential down, beginning at the axon hillock, travels down the axon till it reaches the synaptic terminal. Synaptic terminal just means the distal part of the neuron where its neurotransmitter vesicles are stored. And it'll open up, it'll change the voltage in the plasma membrane at the level of the voltage-gated calcium channels. These are VGCCs, voltage-gated calcium channels. And this depolarization of the plasma membrane at the voltage-gated calcium channels will cause them to allow calcium to come into the cell. Then the calcium coming into the cytoplasm of the synaptic terminal is the signal that the neurotransmitter vesicles should travel down to the plasma membrane here, merge with this plasma membrane, release their neurotransmitter vesicles into the synaptic cleft. They'll diffuse across the cleft, bind to a receptor on the postsynaptic neuron, and activate it. Okay, that's neuronal transmission, how neurons communicate in the brain. Okay, and you have a seesaw relationship between glutamate and GABA. Glutamate's more common, much more common. It's 90% of cortical neurotransmitters. It's excitatory, activates things. GABA shuts things off. Okay, it's inhibitory. It's about 5% overall in neurotransmitters. All right, I think we're going to leave it at that for today. I'll come back in the next one and I'll start going through more of this synaptic anatomy and how synapses work and stuff. I hope you found that helpful.